I think the first point would be that sepsis is a medical emergency, so time is critical. So recognising and providing treatment as quickly as possible is really essential, and fluids are obviously one part of that treatment matrix. And so I think the second point would be that the fluid type is important. It does impact on patient outcomes. For instance, hydroxyethyl starch should never be used. And we know that selecting a crystalloid such as normal saline or balanced salt solutions currently the recommended fluid type in resuscitation of sepsis. And thirdly, I think the ongoing reassessment of our patients' fluid status is probably really an important aspect. So we can't just accept that the bag of fluid that is that sitting, being given to our patient is what they actually need. Ask the question: does my patient need this fluid, or do they need a different type of fluid? And so I guess that kind of sums up remembering the 5 R's of your intravenous fluid administration is probably a take-home point.